Hey, everybody. My name's Doug with Maximum Wealth. Thanks for joining us today. I'm here with Mike Buckner. He's with Western Southern Financial. Mike is an expert on healthcare in retirement, and we are here to try to provide you with as much information about how to prepare for the issues of healthcare once you retire. And our previous video got into the cost and what was involved with what you may expect to have to come out of pocket with in the future as far as healthcare goes. But we've got some noise in the background. Sorry about that, Mike. And we are going to dig down more into the aspects of Medicare and how Medicare works today. So, Mike, I'll let you take it away. Thanks for being here for us today.
Thank you, Doug, and it's a pleasure to be here. We got through our first segment, which we talked about the cost of healthcare and retirement, and
right.
we saw the staggering cost, and now we're going to get into some of the fun stuff, which is the overview of Medicare. And we're in Medicare season right now, where people are having to start to make choices on what they're going to do. And I will tell you, this is very, very complex. It's not an easy choice.
Okay.
You can change your mind. It's not like Social Security where it's a one and done thing, but there's certain time frames within the year where you have to make decisions, or if you want to change your mind, you have to do it within a certain time. So we'll go over that here. This stuff can get a little complex, but again, what I'm going to preface is we are not trying to make you experts in any of this. This is give you some knowledge, and then you bring some of that knowledge and contact Doug, and he can help walk you through this. Doug always has access to me, so we have questions, or you have questions, or what have you. We can all get together and talk about hey, what may be the best plan for you.
That's right.
So with that, let's kind of go over our friend Medicare. And, here's basically some fun facts about Medicare. We right now, and this is a 2021 study by the Alliance for Retired Americans, Social Security and Medicare, current facts and figures. So this is nothing that I came up with. But right now we have about 180 million workers contributing to Medicare. Now, as that baby boom generation starts to retire, we're probably going to see less of those individuals contributing to Medicare. But right now, 1.45% of your wages goes to fund Medicare. And that is what we call Part A, and that's approximately 62.7 million people that are receiving those benefits that you as a worker are funding right now. Now, Part A, which we'll talk about in a little bit, is going to be projected to be depleted. That trust fund that we're funding out of our wages at 1.45% is expected to be depleted in 2026 if we go the rate we're going. And so basically those revenues are only going to be dedicated to pay about 90% of the cost of Part A. And like I said, we'll talk about Part A in a minute. But you need to think about that, because as we see the transition of the baby boomers out of the workforce, the problem will only probably compound. So how can we fix this? Well, it may not be 1.45% of your wages anymore. It may actually go higher. And you think about what we're looking at right now with the trillions of dollars that the government wants to spend on different items. This being probably part of it. So again, we're going to have to do something to help with the cost, because it's only going to go higher, in my opinion.
Sure.
So just some facts about Medicare. Again, we talked a little bit about Part A and that you funded out of your paycheck. 1.45% comes out of your paycheck. But there's Part B and then there's Part D. And I'm leaving out Part C, and there's a reason for that. I do know the alphabet, but there's Part B and Part D. And they're going to be adequately financed. That's not a problem because it comes from general revenues. And also it comes from you, beneficiary premiums. So you're paying into that. So it'll be financed indefinitely. We have no problem with that. The problem we have is with Part A at some point in the future. So how do you qualify for Medicare? And so as far as qualifying for Medicare, one of the things that you have to be is you have to be at least 65 years or older. And if you happen to be working, you don't have to elect Medicare. There's ways that you can opt out of not having to go ahead and collect it if you're still working and covered under your employer's health care plan. Also, if you're younger than 65 and you've been receiving Social Security or railroad retirement disability benefits for at least 2 years, you can qualify. If you're younger than 65 and have end-stage renal disease, you can qualify for Medicare. Or if you're younger than 65 and have what we know as Lou Gehrig's disease. So basically, for most individuals, you qualify for Medicare once you attain that special age of 65 years old. So how does Medicare work? And as far as how Medicare works, we'll get into that in a few minutes, but I just wanted to give you an overview of right now when and how you qualify for Medicare. So
Mike, I'm sorry.
Yes.
Let me jump in and ask a question. The application, I guess the act of beginning your Medicare insurance, isn't there a time period there that people need to apply by their before their birthday of 65 if they're going to do that?
Yes, there is. And we'll get into that because in your slides, but yes, typically there is a time period that you have to apply prior to actually receiving Medicare. Typically, you'll want to do it 3 months in advance, but we'll talk about that further into the presentation here. But I want to take a quick break because I wanted to show you just basically how and when you qualify for Medicare. And so with that, let's jump into the next set of slides here, and is how does Medicare work?
Okay, we're back with Mike Buckner from Western and Southern Financial, and we're looking at exactly how Medicare works. We're going to dig down into the nuts and bolts of our Medicare system and look at how an individual is going to be treated during claims, during a time that these benefits are being made available to someone that are in need of the benefits. So, Mike, I'll let you take it away and proceed forward here with our discussion.
Okay, so how does Medicare work? Well, there's different parts to Medicare. You have Part A, you have Part B, there's Part C, and there's Part D. And we're not actually going to go in that specific order, and there's a reason for that, and I'll get into that in a few minutes. But Part A is basically you don't pay premiums. So think about it like hospital, inpatient hospital stays, care in a skilled nursing facility, nursing home care. This is not long-term care. This is nursing home care as long as custodial care isn't the only care you need. Hospice care and some health care. But also don't forget that deductibles, coinsurance, and other payments may apply. But when you think Part A, think about hospital, and you don't pay any premiums. Now, I've been told when I've given these presentations to clients, well, what do you mean I don't pay any premiums? I've been paying that 1.45% out of my wages for years.
Right.
So I have technically been paying premiums. But when you go ahead and you use Part A, you're not paying any premiums for that.
Okay.
So Part A, think of hospital. Part B, think of doctor. And so this is like going to, I have an annual physical this week. So I'm going on Friday, and if I was covered under Medicare, it would fall under Part B. This is going to see my doctor for, lab test. Maybe if I need to have a surgery done, like my dad has to have hip surgery, that would be Part B under his Medicare. Any mental health issues that may arise, that's all under Part B. And you're going to pay a premium for this. And in 2021, the premium for the majority of people is $148 a month. Now, where does that premium come from? It comes right, if you're collecting Social Security, it comes right out of your Social Security check. And like I mentioned earlier, that nice 6% raise that you're going to get from Social Security this year, these Part B premiums are expected to go up a little bit higher than we've seen in the past. So your 6% raise is probably not going to feel like a 6% raise.
Mm-hmm.
It actually can be higher than $148, and it's really based on what we call your modified adjusted gross income. And your modified adjusted gross income, think about that as that bottom line number on your 1040. So when you go down and you look at your 1040s that you're filling out every year, your modified adjusted gross income is that last number you're going to see. And if that's higher, you could be paying more than $148. There is a $203 deductible per year. And after that deductible is met, you're typically going to pay 20%. So you got your $203 deductible, and then once you beat it, you're paying 20%. So think of
does that 20%, is there a cap on the overall charges, or is it 20% for whatever amount is being charged at that point in time?
For whatever amount that's under the Part B under their under doctor.
Sure.
So think of doctor visits, surgeries, things of that nature.
Right.
So Part A, hospital. Part B, doctor. Part A, you don't pay any premiums. Part B, you're going to pay a premium for.
Okay.
And here is where it gets a little, I don't want to say complicated, but we got some numbers here on the screen, and
sure,
you can see that, if you're filing as an individual and your adjusted gross income happens to be $88,000 or less, or you're filing jointly, and that's $176,000 or less, you're going to pay $148 a month. And that's, again, your modified adjusted gross income.
right.
As you up the scale, as you start making more money, your premiums that you pay are going to go higher and higher and higher. If you're in the category where you're making $500,000 or and above as a single, or $750,000 and above, and you're filing a joint tax return, you're looking at $504 a month in premium. So what individuals will do if they don't want to pay these higher premiums, they look at ways to keep their modified adjusted gross income down. Sure. And a few ways that I know how to do that. And municipal bonds is not one of them. included in your modified adjusted gross income.
Right.
Roth IRAs work really well,
Mm-hmm.
but also tax deferred vehicles like annuities. They keep your modified adjusted gross income down because they grow tax deferred.
Mm-hmm.
Okay. And mandatory required minimum distributions like you have with your IRAs. Once you turn 72 now, you got to take money out of your IRAs, and that's included in your modified adjusted gross income.
Right.
Also, cash value life insurance.
Mm-hmm.
Value life insurance, the buildup on that is tax deferred. So 3 ways that I look at to keep your modified adjusted gross income down so you're not paying higher premiums is number 1, look at Roth IRAs.
Yep.
And by the way, we may be seeing some changes with Roth IRAs, and that's part of this new proposal that we're seeing within the government. Also, annuities. That's the second way. And lastly, the third way is cash value life insurance, which is tax deferred. And the nice thing about the life insurance is I can utilize that product to take loans and withdrawals. And if I utilize it properly, that income is not considered part of my modified adjusted gross. So it can actually help keep your premiums down for your Part B portion of Medicare.
Let me jump in and ask a question, Mike, because I agree with you everything you're saying about reducing down that modified adjustment with the Roth, with the tax deferred annuities, and with the cash value life insurance products. On the Roth product, are Roth IRAs, is there a required minimum distribution, or is that something that is coming down the line here as far as the Roth goes?
With Roth IRAs, there's no required minimum distributions.
Okay.
However, when you pass away, and if you happen to have a non-spouse beneficiary,
Mm-hmm.
your spouse beneficiary is going to be required, and this changed under what we know as the Secure Act.
Right.
Last year it actually changed, that your beneficiaries of your Roth IRA are going to have to empty that whole Roth IRA out over a 10-year period.
Right.
Bottom line. So Roth IRAs for wealth transfer, and you have the same problem now with traditional IRAs with wealth transfer.
Right.
It's hard.
Sure.
You're not seeing the what we used to call the inherited IRA or stretch IRA programs. Those types of things have really gone by the wayside. They were fabulous planning techniques, but now we're having to look at ways to, if you're wanting to pass wealth down to the next generation. And this is probably a good topic, Doug, that you and I could have at some other point where we talk about wealth transfer and estate planning. Life insurance is really starting to come to the forefront as probably the better way for wealth transfer because of the changes that we've seen with our retirement vehicles,
Right.
such as IRAs and our Roths.
Well, something else too, Mike, that I wanted to bring out about using the tax deferred annuities or life insurance contracts. You do have a degree of control over those things as far as the pullouts on that. And so if you're in a year, if you're a high income individual, you've got a year that you absolutely do not need to take that money. Obviously, you can kind of regulate how that money comes out of those things depending on the amount of money you need during that year. And it may be that, you want to pull 1 year, if you have to pull from that cash value on that life insurance policy and do so and arrange it in a way where it is that tax-free avenue there to receive that income. But at the same time, you have the control on that lever as to whether to release that money or to keep it in, rather than relying on putting all of your money in your earning or growing wealth years into those IRAs or into those qualified plans.
Right, right. So yes, because at age 72, Uncle Sam is coming after your IRAs and your qualified plan assets. So you sort of lose control over that. With our
Absolutely.
preferred annuities, with our life insurance, we control it.
That's right.
We decide when we want to take the money out, and if we want to take the money out. It gives us that leverage, which I believe is very important. And you think about it, that why they got rid of these provisions that we had with stretch IRAs and stretch Roth IRAs. It's because this is a way to raise revenue for.
Sure.
And so having to empty these things out in 10 years puts a lot of tax dollars in the government's pocket.
Well, and I think it's going to be a necessary evil in the future too, so to speak, in that government is going to need more and more dollars in the future. And so you're going to see these things compounding themselves and this situation getting even worse going forward.
Yep, I tend to agree. Okay, so let's talk about Part D, and I'm skipping over Part C for a reason.
Okay.
And I'll talk about that in a minute. But Part D, think drugs. And this is optional. It's optional prescription drug coverage that you can utilize. Why you would not want to utilize it, I don't know, because I do take some prescriptions myself, and they're expensive.
Sure.
They're offered by private insurance companies that Medicare must approve. You're going to have premiums, you'll have deductibles, you'll have co-payments, and co-insurance will apply. So Part D is drug. Again, Part B, that's your doctor.
Right.
And Part A, hospital. So A, B, and D is what we've covered so far. Now we have something called the donut hole. And actually, that's making me look making me feel a little hungry right now. But yeah, it does look good, doesn't it?
Yeah.
So we have this donut, what's called the donut hole. Many of you have probably, if you've looked into Medicare, have heard about this. But this is for drug coverage. And what basically happens under the donut hole is, and this is for 2021, you have what's called your deductible phase, and you're going to pay a deductible until you reach $445. And then after that, you're going to hit what's called an initial coverage phase, where you pay a copay or co-insurance, and that's for up to $4,130 in 2021. And then you're going to enter what we call our donut hole. And with the donut hole, you're going to end up paying 25% of the cost of brand name drugs and 25% of the cost of generic drugs until you exceed $6,550. And that's in 2021. So you get into this donut hole, and the donut hole is not very fun because you end up paying a lot more. But
Right.
then once you get out of that donut hole, if you exceed that $6,550, you get into what we call the catastrophic coverage phase, and you're going to approximately pay 5% of drug price once you're reaching the out-of-pocket limit.
Mm-hmm.
You can find more information on this if you go to Medicare.com. They have wonderful information if you want to read more about this donut hole coverage. But just realize that there's different phases, and falling into that donut hole is not fun for a lot of folks.
Yeah, you hear a lot of people complaining about that when that happens, and it's I don't know if it's just ironic or it's just coincidental, but there are so many people that really fall into that and have a problem with that because that's I guess they've got that there as a reason, as a catch-all, so to speak. But it seems like a lot of people end up in that donut hole every year, and they stay there. They're either just over in it, or they have not reached the point of getting out of it yet. And you hear
Yeah,
about that a lot, you know.
you hear that a lot because, a lot of people don't have $6,550 worth of bills.
Right.
They just, so they're there and they never get out. And, and if you get out, now you're in the catastrophic phase, and that's probably not a good thing for you.
No, you're not in a good place if you're at that.
You're not in a good place at that point.
Yeah.
So, I don't know. Your healthcare coverage at that point is probably going to go even higher because now you've got issues.
Yes, right.
It's kind of strange how it works, but that's how it's done.
Mm-hmm.
Now, Medigap policies. You've probably all seen commercials on TV about Medigap policies, and these are policies that are sold by private insurance companies. And basically, a Medigap policy is utilized to pay healthcare costs that Medicare doesn't cover, like your co-payments, your co-insurance, your deductibles, and premiums, for Part B and Part D. But again, you'll see that some insurance companies will offer Medigap policies. They have to be sold by a licensed insurance agent that's licensed to sell healthcare insurance. They're out there. People do utilize these. They can be very useful. If you have high Medicare or high healthcare cost. That's those Medigap policies that you hear about on your TV commercials, or maybe you have been solicited by a individual that sells Medigap, and they're not bad. But they're not for everybody.
Something that I would add to that too, Mike, is that these products are available from obviously private insurance companies. Agents for these companies are out there selling these products. But if you're interested in one, try to find an agent. And we have agents. We don't sell those products ourselves, but we have agents that we refer business to that this is all that they do. And they're very strict in their marketplace about what they're selling and what products and what companies that they're using, and very, very knowledgeable, very educated. And so they specify and stay in these marketplaces. And I would highly recommend to make sure that you're talking to someone that knows these products and knows these services to get the best product and the best service for what you're paying for here.
That's right. And I would echo that, Doug, because you don't want individuals that dabble in selling Medigap policies, because they need to understand how Medicare works. They need to understand your Part A, your Part B, your D, what your health is like. They should know this stuff inside and out, and they should be able to get you the best Medigap policy for what you need, because there's different costs for these Medigap policies depending on what type of Medigap policy you need. And if you got someone that's selling you something that's too high of a premium, you don't need it, why'd you do it? So again, working with educated folks in this area, because Medicare is not easy to understand. And you can go out there to Medicare.com and read through it. They have books and things of that nature, but working with somebody that can actually explain this to you.
That's right.
Like I always say to people, I'm not a doctor, and I would not try to do surgery on myself. And I wouldn't expect, to have you go out there and try to research Medigap policies or or Medicare and try to figure it out yourself. Work with somebody that is an expert in this area.
But you know as well as I do, in this information age that we live in, the quick and easy way is to go out there and look online, buy from a commercial. Those are the things that's how that stuff works. And it to me, to take that time, because what happens at the moment of sale, because of maybe an inexpensive price, or maybe you like the commercial or whatever, or the website is easy to maneuver around, that moment of sale and what you think you have can be completely different in the future when you go to the doctor and you have a claim to be paid. It's always good to know what's going to happen in the beginning of purchasing an insurance product, rather than buying it and then finding out later it's not what you thought it was after you bought it. And I know that sounds like old information, but I think it's more so pertinent today in today's marketplace than ever before, because there's so many avenues or venues to be able to buy something or to purchase these products.
Right, right. Agreed. So let's go ahead, and I want to skip here to something called our Medicare Advantage plans.
Okay.
This is Part C, and so we had our Part A, our Part B, our Part B, and we call this Part C, and these are Medicare, what we call Medicare Advantage plans. Medicare Advantage plans, and this is something, if you turn the TV on again and you're watching a news channel or whatever else, you may see actors of yesteryear come on and talk about their Medicare Advantage plans. I think of Tom Selleck, and he's out there touting these Medicare Advantage plans, and I think they're wonderful plans. Basically, what they're going to do is take care of Part A, Part B, and oftentimes your drug coverage, your Part D. And think of it just like your health insurance that you had while you were working. They're offered by private companies that contract with Medicare, and they're going to provide all of Part A and Part B. You're still going to be in Part A and Part B, but these Medicare Advantage plans are going to take care of all of the coverage that would be offered under Part A and Part B. And they're kind of like, I almost want to call them like an HMO. And you can call them an HMO. I mean, they're health maintenance organizations, preferred provider organizations, private fee-for-service plans, special needs plans, medical savings account plans. And they also offer additional benefits such as your vision, your dental, and your hearing. So, how do you make a decision as to, should I really jump into a Medicare Advantage plan, or should I just stay with normal Medicare, which is your Part A, your Part B, and your Part D?
Right.
And there's no easy answer to that question.
Right.
A lot of it can actually depend on where you live, because there's network and service areas, and sometimes those network and service areas can be very different. For example,
yes.
I live in New York, for example, and I'm a snowbird, and I want to go down to Florida, and I decide that, hey, I'm gonna spend my winters in Florida, and then after the snow is gone up in New York, I'm gonna go back up to New York. I happen to get my Medicare Advantage plan up in New York. Well, I'm down in Florida, and for some reason, I need to go see the doctor.
Mm-hmm.
I get into an accident or whatever, I fall, or who knows what happens. Guess what? could happen. You could go to your doctor and they're going to tell you, oops, your Medicare Advantage plan is not going to work in the state of Florida. It worked fine in the state of New York, but you're out of network. So it's very important to understand the Medicare Advantage plan that you're purchasing.
Mhm.
I'm sure Doug has a number of agents that he works with that really understand these Medicare Advantage plans. And again, like I said, some of these Medicare Advantage plans will offer also your prescription drug coverage as well. So it kind of wraps everything up, which I think is kind of nice. But realize you're still having to pay your Part B premiums. There's no way out of that.
Right.
But, you know, this is just really a personal choice. You know, you look at where you live, your network coverage, the service areas. You know, if I get a plan in New York and I happen to, you know, want to go down to Florida for whatever reason, I want to make sure that that plan covers me no matter where I go or where I visit. So that's important. And again, this goes back to, hey, I'm not trying to make you an expert in all of this stuff, but working with educated individuals that understand these types of plans is very, very important, especially when it comes down to the Medicare Advantage plan.
Let me jump in and say this too, Mike. If you've got seniors that are already in a plan, maybe not the Medicare Advantage plan, but have Medicare, maybe have a Medicare supplement type policy, and they talk to someone or been convinced to look over into the Medicare Advantage plans and wish to change coverages, it is even more vital that they talk with someone that understands what their current position is and what their moving to or new position would be, so that they can give them an understanding of this is what you're moving from and this is what you're going to have. Because you could go into a worse situation, or you could go, you know, into a position to where, you know, your pharmacist or your pharmacies in the area would not be able to accommodate you, or maybe accommodate you better. But it just gives more credence to talking with someone that really understands these plans, rather than just a health insurance agent out there that has these plans available to the public. A specialist is to me is vital in working with these plans here.
Yep. I mean, anybody can go out and take a, you know, not to belittle, you know, anybody in the insurance industry, but anybody can go out and take a test and get qualified to sell you a Medicare Advantage plan. We can get an health license, and insurance health license. I can go out and study for, you know, about a month for it and pass the test, and I can go sell you a Medicare Advantage plan. Does that mean I'm an expert in that area? It definitely does not mean I'm an expert in that area.
Correct.
And working with competent individuals that understand your needs, coverage areas, all of that, just what Doug mentioned, is so vitally important. You don't want to work with somebody that dabbles in it. And that's one of the things that concerns me when I do watch some of these commercials on TV where it says, call 1-800 blah, 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 and talk to somebody on the phone, and we can help you select the plan, the best plan for you.
Yep.
You may be talking to somebody out in California, and you happen to be living in New York, and you're visiting Florida, like I mentioned, during the wintertime. They really understand your area. They understand your coverage area. They understand, you know, the pharmacies in the area that you like to go to. Do they understand the doctors that you would like to visit?
That's
so
right.
Working with somebody locally that understands this is so beneficial.
Don't get caught up in the companies that are marketing. get caught up in someone that understands the programs and the benefits and how all of these things work, because it's easy to get caught up in these companies that are advertising. It's really more about marketing than it is about educating the consumer. And that's really where people need to be, is about the education side of it before they make any changes or any moves in anything that they're doing here.
Okay. So with that, I think we're going to take a little bit of a break here, and then we're going to get into the next fun part, which is enrolling in Medicare. And I even have to cheat on this, and I have to, because I don't, this gets complicated. I don't have it committed to my memory. So you're going to see me once in a while look off screen and have to actually read something, because it can get complicated as to all of these different dates that you need to be aware of. And if you've missed certain dates, it can be problematic as far as, coverage. So with that, let's go ahead and take a break, and then we'll go through our next segment.
All right. Thank you very much, Mike, for helping us here with all of this information. I know it gets deep into this, convoluted, a lot of numbers, a lot of information. Thank you very much for staying with us today on the podcast and on the video. And we will be back in a next segment. My name's Doug with Maximum Wealth. Thanks for joining us today. And please subscribe to our channel, visit our website at MaximumWealth.net, and we will be back with a more in-depth look at Medicare. Thank you.